हेलो एवरीवन, माय नेम इज़ हिमाद्र पांडे और मैं वी टुगेदर द्वारा आयोजित किए इस इवेंट में, इस सेशन में आई हार्टली वेलकम यू ऑल. We Together Care is a online community for CKD patients and हमारी कम्युनिटी पर हमारे प्लेटफॉर्म पर CKD पेशेंट्स अपने एक्सपीरियंसेस शेयर कर सकते हैं ताकि लाइक वट एवर दे हैव बीन थ्रू so that others could like learn from it, grab something out of it. And uh, we have an excellent team of doctors, financial team as well as. And if you go to a site which is vtogether.care, वहाँ पर आपको chronic kidney diseases या CKD से रिलेटेड बहुत सारे आर्टिकल्स और वेरीफाइड इंफॉर्मेशन मिलेगी. And recently we have added two more tabs to it, which is the sports tab and the news tab. So where you could get recent news related to kidney transplants and kidney related news basically. So आज ही आप वी टुगेदर का एप्लीकेशन डाउनलोड करें. Moving on further with the session, आज वर्ल्ड फूड डे है and every type of food intake in the human body has its own effect. Like you eat something, it is going to have some sort of effect on you. I'm pretty sure that our viewers, हमारे viewers के मन में भी ऐसे ऐसे क्वेश्चंस आते होंगे. अगर मैं ये खाऊं, ये एक्सेसिवली खाऊं, ये खाऊं, ये कम कम खाऊं, तो इसका हमारे ओवरऑल बॉडी, मेंटल बीइंग पर क्या इफेक्ट रहता है. एंड इन सारे सवालों को सॉल्व करने के लिए, इनका जवाब देने के लिए हमारे साथ आज मिस करिश्मा शाह मौजूद हैं. मैम, आई वुड लाइक टू टेल दैट कि करिश्मा मैम ने इंटीग्रेटिव हेल्थ न्यूट्रिशनिस्ट हैं. शी इज ऑल्सो ट्रेन्ड एज अ होलिस्टिक हेल्थ एंड wellness coach, and she as well has a PhD in the same. And if we talk about her approach, she's a multidisciplinary, and she believes that mind, body, and soul ki overall wellness should be the top priority of anyone. So I will be handling it now to Rahul sir for further discussions. And hello, ma'am. Welcome to We Together Care.
Thank you. Thank you, Himadra, for a
Thank
very
you.
nice introduction.
Thanks, Himadra, and Krishma ma'am. Very warm welcome to this event. I think we are very happy having you here today because it being the World Food Day. I think in one of our sessions earlier, हमने एक पेशेंट थे, उनसे बात की थी जिन्होंने बहुत ह्यूमंगस ट्रांसफॉर्मेशन लाया था. एंड उन्होंने आई थिंक एक बहुत क्लासिकल स्टेटमेंट जो काफी पॉपुलर है, उन्होंने कहा था कि यू आर व्हाट यू ईट. सो बेसिकली ही चेंज द वे उनका ट्रांसप्लांट हुआ था, और जिस तरीके से उन्होंने दिग्विजय सिंह नाम है उनका, तो उन्होंने जिस तरीके से चीजों को बदला है, तो उन्हें कोई देख के कह नहीं सकता कि वो एक ट्रांसप्लांट पेशेंट है. सो ये बहुत महत्वपूर्ण बनता है vtogether.care इस प्लेटफॉर्म के लिए, क्योंकि हमारे साथ जो जुड़े हुए लोग हैं वो सारे जो हैं वो क्रॉनिक किडनी डिसीज पेशेंट्स होते हैं, और वो हमारे मेंबर्स भी हैं. और ये जो कार्यक्रम हम आज आपके साथ कर रहे हैं, ये कार्यक्रम भी जिन लोगों तक पहुंचेगा, मोस्टली वो किडनी डिसीज रिलेटेड पेशेंट्स ही होंगे, और उनके केयर टेकर्स, उनके फैमिली मेंबर्स. सो डाइट इज अ वेरी इंपॉर्टेंट पार्ट किडनी डिसीज के अंदर. इट प्लेज एक्सट्रीमली इंपॉर्टेंट पार्ट, क्योंकि ये एक ऐसा डिसीज है जिसके अंदर कई सारी रेस्ट्रिक्शंस होती हैं. पेशेंट्स को पानी की रेस्ट्रिक्शन होती है, खाने की रेस्ट्रिक्शन होती है, प्रोटीन इनटेक की रेस्ट्रिक्शन होती है. तो ऐसे समय पे डाइट एवरीडे का पार्ट है, और आप स्पेशली जब फैमिली के साथ रह रहे हो तो अदर्स आर नॉट सफरिंग, आपको मुश्किल है, तो डाइट की रेस्ट्रिक्शन सिर्फ आपको ही होती है. तो ऐसे समय में उस टेम्पटेशन को हैंडल करना, उस सिचुएशन को हैंडल करना, और फूड इज इंटीग्रल पार्ट ऑफ आवर लाइफ. आई थिंक कई सारे लोगों का मानना है कि खाने के लिए ही लोग जीते हैं, तो इट इज वेरी इंपॉर्टेंट पार्ट. ऐसे समय में इट इज वेरी अनफेयर विद kidney disease patients because they have a lot of limitations, and I think it takes time for them कि वो डाइट, रिस्ट्रिक्टेड डाइट तक आए, और वो उन्हें प्रैक्टिस के थ्रू ही अचीव करना पड़ता है. सो हमें बेहद खुशी हो रही है कि आज आप हमारे साथ जुड़ी हैं, और जिस तरीके का आपका एक्सपीरियंस है, आपका क्वालिफिकेशन है, जो काम आपने किया है, वी आर वेरी कॉन्फिडेंट कि हमारे सारे व्यूअर्स को इसका काफ़ी बेनिफिट होगा। So before we move forward, I would really pass it on to you in terms like you would want to give little idea about yourself, little more that our viewers can, really know about you.
Thank you, Mr. Rahul, for such kind words and also the information जो आपने अभी बताया
जी,
कि जो किडनी पेशेंट्स होते हैं
जी,
ट्रांसप्लांट बोले या क्रॉनिक किडनी डिजीज की भी अगर सीकेडी की अगर हम बात करें, राइट,
जी,
तो उन्हें कभी-कभी ऐसा लगता है कि क्वालिटी ऑफ लाइफ में भी
हुँ,
अच्छा नहीं रहेगा क्योंकि फिर
हुँ,
खाना रिस्ट्रिक्टेड है मेरा,
हुँ,
टेस्ट नहीं आएगा, एक्सेट्रा
जी,
एक्सेट्रा। सो
जी,
सबसे पहली बात मुझे ये बतानी है कि ये जो माइंडसेट है, वो
हुँ,
माइंडसेट शिफ्ट करना बहुत ज़्यादा ज़रूरी है। आपकी
करेक्ट,
क्वालिटी ऑफ लाइफ डिक्रीज़
हुँ,
नहीं हो रही है। आपकी
जी,
क्वालिटी ऑफ लाइफ इंक्रीज़ हो रही है क्योंकि आप
इंक्रीज़
अभी
हो रही
ज़्यादा माइंडफुल रहेंगे कि आप क्या खा रहे
करेक्ट,
हैं, आपकी बॉडी में क्या जा रहा है एंड यू आर गोइंग
करेक्ट,
टू आल्सो हैव दिस थिंग कि अब जो भी खाएँगे, अब जो भी सेवन करेंगे, पौष्टिक होने वाला है। कचरा नहीं खाएँगे क्योंकि आप माइंडफुल हो चुके हैं अभी और
हुँ,
क्वालिटी ये सब चीज़ों से बढ़ती है, ना कि डिक्रीज़ होती है। तो एक
वेरी गुड,
जो बहुत ही ज़्यादा डिप्रेसिव माइंडसेट है या बहुत ही ज़्यादा सैड माइंडसेट है ना,
हुँ,
सारे जो क्रॉनिक किडनी के पेशेंट्स होते हैं,
जी,
उनमें ये डालना बहुत ज़्यादा ज़रूरी है। सो हमारे पास जब मेरे पास जब क्लाइंट्स आते हैं, पेशेंट्स आते
हुँ,
हैं, तो
हुँ,
हम डाइट के ऊपर काम करते हैं। मैंने अभी प्रेज़ेंटेशन बनाया है जो मैं अभी आई एम गोइंग टू शेयर वेरी सून नाउ
जी,
एंड मैंने टिप्स बताए हैं, मैंने गाइडलाइंस दी हैं सारी। पर अपार्ट फ्रॉम दैट एक छोटे से 30 मिनट्स 1 आवर के सेशन में मैं सब कुछ नहीं बता सकती। आई हैव ट्राइड अ लॉट कि मैं
ट्रू,
जितना ज़्यादा गाइडलाइंस दे सकूँ मैं उतना दूँ। बट आई आल्सो
जी,
वांट टू टेल यू दैट अगर आप सुन रहे हैं एंड यू हैव सम काइंड ऑफ अ किडनी डिजीज़ और यू हैव सम काइंड ऑफ अनकम्फर्ट व्हेरेवर योर रीनल डिस्फंक्शन इज़ कंसर्न्ड और अगर आप फैमिली मेंबर्स हैं, केयर टेकर्स हैं, प्लीज़ अंडरस्टैंड दैट एक जो ओवरऑल माइंडसेट होता है, एक जो एनवायरनमेंट होता है, that is very important to be in a positive state of mind rather than a negative state of mind. That can shift so
वेरी
many
ट्रू,
things, you
वेरी
know.
ट्रू,
So
यप,
I feel like सबसे पहला ये। सेकंड
जी,
चीज़ हाँ, दूसरों से ज़्यादा अटेंटिव तो रहना पड़ता है, दूसरों से ज़्यादा अलग थोड़ा डाइट होगा, पर जैसे मैंने बताया कि नॉट नेसेसरी कि हम टेस्ट के ऊपर कॉम्प्रोमाइज़ करेंगे, नॉट नेसेसरी
हुँ,
कि हम कुछ भी नहीं खाते हैं या हम बाहर नहीं जा सकते। देयर आर वेज़
हुँ,
एंड मीन्स इन व्हिच वी कैन डू दिस, हम इसको एडजस्ट कर सकते हैं। अगर
हुँ,
आपको एक अच्छे मेरे जैसे बहुत सारे हैं, देयर आर सो मेनी क्वालिफाइड पीपल हू आर एक्सपर्ट्स, डायटीशियंस, न्यूट्रिशनिस्ट्स, हू कैन हेल्प यू अंडरस्टैंड कि आप कैसे प्लान कर सकते हैं, आप क्या-क्या खा सकते हैं, अगर आप ट्रैवल करेंगे तो आप क्या ले सकते हैं, ट्रैवल नहीं करेंगे तो आप क्या ले सकते हैं। सो ऑल दीज़ थिंग्स कैन बी गिवन टू यू इन अ वेरी ईज़ी वे जो आप
हुँ,
डेली आपके डेली रूटीन में आप इसको एडजस्ट कर सकें। और ऐसा नहीं है एट एनी पॉइंट यू विल स्टार्ट फीलिंग के अ, अगर मेरा रूटीन अलग है तो मे बी मुझको कहीं न कहीं अलग फ़ील हो रहा है। तो आई फ़ील लाइक
हुँ,
डोंट थिंक अबाउट ऑल दीज़ थिंग्स। सबसे पहली बात तो मैं ऑलवेज़ सबको बताती हूँ दैट आपका डाइट जितना ज़्यादा क्लीन रहेगा, जितना ज़्यादा अच्छा रहेगा, उससे
हुँ,
आपकी क्वालिटी बेटर होगी। नाउ विथ Mr. Rahul, can I share my presentation also while I'm
या, प्लीज़
talking?
गो अहेड, या, दैट वुड बी बेटर,
Okay, great.
यप,
Let me just take everybody step by step, right? So with step by step, what do I mean? सबसे पहला let's understand what are the main functions. किडनी के main functions क्या होते हैं? Basic functions जो किडनी के होते हैं, right? It's the detoxification process of our body. हम जब जो भी let's say things like urea, things like our excretion materials, right? All those things are very important for us to be able to detoxify from the body. Um, all the waste products, all the toxins, all the things from the blood which are not needed are finally excreted in our kidneys. After this, it helps us to conserve our electrolytes. It helps us to conserve water and the salts that we're eating every single day, right? It helps us to conserve these things. After this, it also breaks down toxins inside our urine. The kidneys are that beneficial for us. It helps us get rid of all the things that we don't need, even within our urine purification.
हुँ,
After this, it maintains the bodily fluid of our body. Very
हुँ,
important to understand. And why am I explaining all these things? Because when I start giving you the guidelines, it's very important to understand what function what plays. So that
या,
जब आप um, जब आप डाइट फॉलो करेंगे, आप सिर्फ ऐसे नहीं फॉलो करेंगे कि नहीं हमको बताया गया है कि हम यही खाएंगे, नहीं ऐसा नहीं है। उसके पीछे एक
अप्रोच।
रीजन है, उसके पीछे बॉडी का एक फंक्शन है। अगर आपको इन्फॉर्मेशन एजुकेशन मिली होगी तब जाके आप डॉट्स कनेक्ट करके आपको मन करेगा रोज ये करने का। दैट्स व्हाई in my profession and when I consult with patients and clients, I always educate them. I always tell them about what the functions are and how things are connected to each other, right? So,
Yeah.
they're also very essential in maintaining our blood pressure levels. Kidneys play a very big role in blood pressure management. Um, they're also very, very important in, storing or probably, also excreting anything that is extra as an acid in our body. This is a very big
Correct.
function of the kidney as well. Now, everybody knows the functions of kidneys. What is next? Now, what
Yeah.
happens when we have a chronic kidney disorder, right? A
Yeah.
chronic kidney disorder is very simple. People in who जिनमें किडनीज प्रॉपर फंक्शन नहीं कर रही है या थोड़ा स्लो किडनी फंक्शन कर रहा है, आप स्लाइड मूव कर सकते हैं टुवर्ड्स दिस इज द थर्ड स्लाइड दैट आई एम टॉकिंग अबाउट.
Okay.
So,
Ashish, please move the slide. Yeah.
yeah. So, the people whose kidneys don't function very well over a period of time, right? They could be getting older in age, or they could have some kind of a condition where it's becoming slower because of the things that their lifestyle has been like, their diet has been like, or medications
Yeah.
that they've taken, right? All these slowly start damaging our kidneys. जब kidneys damage होगी तो automatically जो functions मैंने पहले बताए हैं वो
जी.
सब में प्रॉब्लम आने लगेगा. ब्लड प्रेशर राइज होने लगेगा या तो फिर लो होने लगेगा. हमारे जो टॉक्सिन्स है वो बॉडी में से शायद निकलेंगे नहीं. वाटर रिटेंशन बहुत ज्यादा होने लगेगा बॉडी में. इट विल स्टार्ट स्टोरिंग अ लॉट ऑफ टॉक्सिन्स इन आवर बॉडी व्हिच विल मेक अस फील वेरी अनकंफर्टेबल एंड रिड्यूस आवर इम्यूनिटी लेवल्स एज वेल. It also will make us feel like very sick over a period of time, because our kidneys are very, very important to be able to manage all the above activities that I have told you all, right?
Okay.
So this is what, if anybody has a chronic kidney condition, it means that from a very low level it's been growing to a point where now the kidneys are very weak and they will need extra support. They will need a lifestyle change. They will need a diet change to be able to, or in some cases even a transplant to be able to work more effectively now. Okay.
Okay.
Now let's move on to symptoms of CKD. When somebody comes to us, the most common things that we find out are their symptoms. कौन सी दिक्कत हो रही है, कौन सी परेशानी हो रही है उनको, so that we can help them with specific things. Not everybody who has CKD has the same symptoms. Not everybody who has probably a high blood pressure will also have some other symptoms. But 4 to 5 symptoms from the list, we can move the slide. So
Yep.
from this list that you see on the
Move the
screen,
slide, Ashish. Yeah.
from the things that you see on the screen right now, you could have 4-5 of these symptoms, and then you are a candidate for having chronic kidney disease. High blood pressure being the main one, because as I said, salt regulation, water retention, detoxification of the toxins of your body is a major role of the kidneys. So
Yeah.
high blood pressure, you will suffer from high blood pressure. A lot of cases are anemic. उनका आयन लेवल बहुत कम हो जाता है, बिकॉज अगेन प्योरिफिकेशन नहीं हो रहा है, न्यूट्रिएंट असिमिलेशन नहीं हो रहा है अच्छी से. सो दैट्स द रीजन व्हाई anemia can also be a part of it. You can be low in iron levels. Edema also means water retention of the entire body. So a lot of people who have diabetes are very familiar with the edema word, but it's a very big case in the kidney disease also. So
Okay.
swollen feet, hands, ankles, your face, your body, anything which is swollen and it's there for a very long time is a part of chronic kidney disease. Fatigue or tiredness, because you don't have, you're going to be, if you're anemic, you have high blood pressure, there is a very heavy chance that you're not having energy in your body, so there's going to be a lot of fatigue and tiredness. Decreased urine output, because the kidneys cannot do a detoxification now. It will not be able to excrete the excess volume of water from your body, so there will be a decreased urine output. In some cases, in more chronic cases, there could be blood that can be found in the urine. Very, very dark colored urine also is a part of it, because, as I said, it's not being detoxified. Decreased mental alertness. there can be a lot of severe, fog, brain fog, mental fog,
mm,
where you will not be able to do daily activities on a very efficient level. Loss of
mm,
appetite, itchy skin. The condition can become very severe if your skin becomes very, very itchy because, as I said, moisture, hydration, everything comes in from water, and that water
yeah,
is not being properly utilized in our body because of the failure of the kidneys.
yeah,
Now, there is also another case wherein there can be frequent urination. Frequent urination
yeah,
can happen in a way where there could be some cases where the urination urge is only there in the nights. So there could be
mm,
frequent urination urge only in the night, and towards the daytime you would not feel like going to the restroom again and again. And this
yeah,
could cause a lot of sleep issues for you. If you have to keep waking up again and again in the night, along with being tired, it's going to reduce your quality of sleep. It's going to reduce the way that you wake up in the morning also, right? So
mm,
ये सारे symptoms है that you can have in a chronic kidney disease.
all right,
Now, moving forward, let's get to the food part of it. Okay.
correct, mm,
मैंने लाइफस्टाइल के बारे में बताया था, मैंने माइंडसेट के बारे में बताया था, तो वो हमें
जी,
जरूर करना है. उसके साथ साथ हम न्यूट्रिशन की बातें करेंगे. Now,
जी,
there are a lot of foods which people can take in for
mm,
helping their kidney health. Antioxidants are very important for anybody who has a CKD issue. Why
mm,
antioxidants? Because antioxidants are the main free radicals which are
mm,
then helping your body to detoxify itself. There is another process in which is happening through not your kidneys, but through overall food, through overall, oxygenating of your cells of the body, rejuvenation of the cells of your body, wherein the
mm,
antioxidants play a very big role over here. Right?
okay,
Now, um, अगर you have very low levels of antioxidants, you're not eating good food, you're not eating fruits, vegetables, and everything, there is a very
mm,
high chance that you have heavier oxidization in your body. So you will
mm,
not get vitamin C, vitamin E, vitamin A, which is beta carotene. You will not get these kinds of, antioxidants and, flavonoids in your food because you're not
mm,
consuming the right things for yourself, right? So it's
right,
very important for us that now when I move ahead and I'm going to start elaborating on what you should include in your diet, you have to realize
correct,
that
mm,
antioxidants have to be a major part of your diet when you are somebody who has bad kidney health. Okay?
correct,
Moving on.
very
What are the foods which have very good antioxidant levels or which are very high in antioxidants, right?
true,
Cauliflower, garlic, onion, apple, cranberries, blueberries, raspberries, strawberries, red grapes, egg whites, olive oil, cabbage, red chili. These are some of the foods जो आप every day में include कर सकते हैं with your
mm,
daily diet you have to be
mm,
able to better your health, better your kidney health, because these are very rich in flavonoids. These are very rich in antioxidants, right?
mm,
And they will give you that kind of a boost and a rejuvenation kind of a boost to your cells to be able to produce antioxidants, which in
yeah.
turn will help your kidneys.
Okay, if you don't mind, since we are here, do you also recommend something which is like in a raw form, or is it like, you have to have it in a cooked form, anything of that sort?
Yes, I'm going to come to that. So,
All right.
if let's go to the next slide, and I have mentioned over there. So, you know what? There are some foods which we can take raw, and there are some
Mm,
foods that we can never take raw. It's never going to be good
okay.
for our body if we have this in a raw way, and especially when we are someone who has very weak kidneys, we can't
Mm,
have a lot of raw things. So now let's
mm,
understand what are the things that we can have raw, and what are the things that we
mm.
need to have cooked. Okay.
All right. All right.
Now, a juice of radish leaves is
Mm,
fantastic for your, health, for your renal function, for your kidney health, right?
mm,
Radish leaves can be had raw. They can be juiced and they can be had raw. You don't need to cook them. They're absolutely safe. So you can have
okay.
this juice twice in a day. Now,
Okay.
watermelon. Watermelon is great for your kidneys. Okay.
Mm,
It's about, so, with a lot of kidney patients, they're always restricted with water. They can't
yeah.
have a lot of water in a day. There is a limited amount of water that they're supposed to be having in a day. And that
Correct.
sometimes makes them very anxious, कि अगर
Mm,
ज़्यादा thirst हुआ तो क्या करेंगे, right?
mm,
So
mm,
over a period of time, we need to understand we can eat our water also. We don't always have to drink our water. We can eat our
mm,
water. So
mm,
watermelon is a fantastic food to be able to eat your water, and it's not going to cause too many issues into your with your renal function because it also has
mm.
fiber in it. Okay, so
Okay.
watermelon is great for kidney health. Please include it in your diet. 2 to 3 cups of beetroot juice is fantastic for your overall kidney health. We have to
Okay.
understand beetroot is great in nitrates. Beetroot is great in oxygenating our blood. Beetroot is
Mm.
great as a overall boost of energy. In fact, a lot of my clients also take beetroot juice as a pre-workout. I'm talking about the people who don't have
Okay.
renal function
Yeah, yeah,
failure,
yeah. Mm.
people who are absolutely healthy and they want a good boost before their workout. One glass of beetroot juice is recommended for them. However, in
Oh,
this case, for chronic kidney patients, 2 to 3 cups of beetroot, or let's say example, one glass of beetroot juice had raw every day is absolutely great, and it's going to increase their iron levels also because they'll be
yeah.
anemic. So instead of just popping pills, which is again a very cumbersome thing for them, they
True.
can start having one glass of beetroot juice raw. Okay.
Makes sense. Okay. And again, so with this is with respect to what they typically have a amount of liquid that they should be consuming every day. So with
Yes.
respect to that, I think this can certainly be a part of that entire consumption of the fluid,
Yes, it
right?
is
All right.
calculated. So let's say, for example, if we had to have one glass of radish juice,
Mm,
or we had to have one glass of beetroot juice, right?
mm,
All
mm,
these will be then, if as I said, you will be. अगर आप न्यूट्रिशनिस्ट के साथ काम कर रहे हैं, अगर आप किसी के साथ काम कर रहे हैं जो आपको
mm,
हेल्प कर रहा है, they will
mm.
calculate all these things in your daily
Yeah.
requirement of liquids, and that is
Yeah.
when they will. So not only can you have something, we're only having water, but we're having a liquid which has water
Mm.
and which has other antioxidants, which is actually beneficial
Yeah.
to
Yeah.
our health and to our brain also, right?
True.
To our
True.
kidneys as well. So
Wonderful.
moving on, figs, अंजीर. So जब
Mm,
सीजन अभी सीजन आने वाला है, fresh अंजीर मिलेंगे. So please eat
mm.
fresh figs. और अगर सीजन
Correct.
नहीं है, you can have dried figs. Figs have a host of antioxidant properties, and especially with Indians being so high on eating dry fruits. So I
Mm,
feel like please eat figs. Figs are
mm.
great for your kidney health, and they are great for anybody who has CKD also, right?
All right. All right.
And it's a great, so जब किसी को स्वीट क्रेविंग्स होते हैं, और
क्रेविंग्स होती हैं।
अगर आप डिजर्ट नहीं खा सकते हैं, अगर आपको स्वीट नहीं खा सकते, तो आप फिग्स खा
जी।
सकते हैं. They're safe and they're absolutely yummy and sweet as well.
Yeah, absolutely. Yeah,
Okay.
wonderful.
So along with this,
Next slide.
please increase your intake of fresh fruits, because
Yeah.
fruits have a big concentration of antioxidants in them. I always tell my clients, even women and men who come to me for glowing skin and better hair health,
जी.
I always tell them, please include fruits because they have great antioxidants. And for all CKD patients also, if you include fruits in your diet, a minimum of 3 fruits in a day, it's going to help you in a lot of things. Okay.
Okay. So, just to give little more perspective, because you're recommending fruits, is there anything that they should know that which fruits they should not go at? Already you mentioned some list of fruits, and I'm sure our team is going to place it that way. But still, is there any thumb rule as such, or is there anything that they should know of, like for example sometimes certain fruits that you should really stay away from, especially when it comes to CKD patient? Is there anything that they should know?
So the one thing that I would like to tell you over here is that, we shouldn't restrict anything as such because they're
Okay.
absolutely safe. Okay. But the second thing that I would like to say over here is that,
Yeah.
when we eat fruits, fruits may be
Mm.
fructose hota hai. And fructose
Oh.
also then gets converted into our glucose energy only at the end of the day, right?
Yeah.
So I would
Yeah.
always say that let's not overdo anything. So a lot of
Okay.
patients, when they come and we tell them कि आप एक दिन में 3 fruits खा सकते हैं, एक दिन में 2 fruits खा सकते हैं, right?
Mm.
They always tell us that, oh, if fruits are allowed, then I can have like 5, 6 fruits in a day also, right?
Hmm.
Now that is not okay because you're intaking more fructose now. You're going to be increasing your insulin levels. They're not going to be balanced. We have to
Yeah.
understand, along with you being a kidney patient, insulin is
Yeah.
very important for you because we all know that the insulin hormone is very closely connected to our overall body's function. Even if
Yeah.
you are a diabetic, a lot of diabetics have renal function failure. So
Yeah.
if a
Yeah.
lot of diabetics have renal function failure, you have to understand that these people are also going to have, sugar issues. They're also going to
Yeah.
have to maintain their insulin levels, right? So
Yeah.
when you are
Got
somebody
it.
who has to balance all these insulin levels, you can't have more than 2 to 3 fruits in a day. So I would say there is no major restriction that don't eat this fruit or don't eat that fruit or anything. Fruits are safe to consume as long as
Mm.
you are having them in a quantity which has been recommended to you by your
Mm.
nutritionist, by your dietitian, or by not overdoing it for more than 2 to 3 fruits in a day.
Mm. Okay, makes sense.
Right?
Yeah.
Okay.
Thanks.
Okay. Now, moving ahead, you asked me about the raw and the cooked thing, right? So I'm going to
Yeah.
elaborate on that now.
Yeah.
Fruits, of course, आप raw ले सकते हैं. Now, second thing,
Yeah.
carrot juice. A lot
Okay.
of people who have CKD are, they get a lot of benefits by having carrot juice also. So
Mm.
you can eat your carrot, you can eat your beetroot if you want. Okay, both carrot and beetroot. So beetroot has to be cooked, of course. You can't eat a beetroot raw. You can have beetroot juice raw, but you have to cook and eat beetroot. But if you want to eat
Okay.
carrots, you can definitely eat raw carrots also. There's no problem with it. You can cook, you can
Okay.
steam, you can boil your carrot also, and you can have it. And you can also
Okay.
have 1 glass of carrot juice in your daily allowance of water, because it's also
Yeah.
going to have a lot of vitamin A. Vitamin A is
Okay.
fantastic for your kidneys also. Now,
Mm.
when you say about cooked things, something like Loki. A lot of my
Mm.
patients, a lot of my clients would come to me and they're like, we drink दूधी juice. आपको दूधी juice
Mm.
नहीं पीना है. कच्चा
Mm.
दूधी नहीं ले सकते हैं. बहुत टॉक्सिक होता है बॉडी के लिए, बहुत टॉक्सिक होता है किडनी के लिए. कच्चा लौकी कभी भी मत खाना. Always
Okay.
cook your Loki. You can make a
Mm.
you can make a Loki soup. You can make a
Mm.
Loki sabzi. But
Mm.
please भी करेंगे हम bottle gourd या हम लौकी को cook करके खाएंगे. Right?
Very
Okay.
important information, because this has been there have been certain, like people, food fads or whatever you might call it. We've seen it across, even at outside some of the gardens, jogging parks and all, people selling these, and especially usme ye bottle guard ka jo
Yes.
juice hai, that is very much available. And I
Yes.
think it's very important, people should really take note of it. This is
Yes.
not recommended. You have to
And
cook
also,
it, and you must cook it.
yes, yes. Thank you, Mr. Rao, for elaborating that and also giving an example, which is very true. And I feel like, you know what? One of the things that happens with consuming raw Loki, and I think all the patients who have CKD should know this, that
Mm,
in case your Loki has some or the other kind of toxin, okay,
mm,
जो आपका body शायद process नहीं कर सकता है, because your
mm,
kidneys are weaker, your body will
mm.
have a larger reaction as compared to somebody who has normal kidneys. So please be
Yeah,
very careful about things like any gourd. Okay, basically
yeah,
the vegetables that come under the gourd,
yeah,
GOURD factor,
yeah,
the
yeah,
family, karela, dudhi, ash gourd, the tindi that we eat, the parwal that
mm,
we eat, they all come
yeah.
under this
That
family of.
family, yeah, correct.
ये जो पूरा family है,
Mm,
please cook these vegetables and eat. Do not ever
yeah, yeah,
have raw juice or have them raw in any way.
wonderful. Yeah,
Right.
makes
Now,
sense.
tulsi, the tulsi leaf, of course, being very, very holy, but apart
Mm,
from that, it's fantastic for our health. Everybody
mm,
should be consuming tulsi leaves for immunity, but for CKD patients, they should definitely be consuming tulsi leaves. So,
okay.
tulsi with a little bit of honey is
Mm,
fantastic when you wake up. So, as soon as you wake up in the morning on an empty stomach, you can take little bit of tulsi, 4 5 pattas of tulsi,
mm,
have 1 teaspoon of honey with it, and it's
mm.
fantastic for your gut health also, and it's fantastic for your overall rejuvenation in the morning. So that's one thing that you can have.
Yeah.
Now, tomato
You wanna
juice.
move? Yep.
Tomato juice is fantastic for your body. Now, you can also have tomato in two ways.
Mm,
Tomato is great as a juice, or tomato is
mm,
great as a soup also, right? So a lot of people
okay.
would, they can put it in their subsies if they want, but if they don't want to put it in their subsi, they can have a soup of it or they can have a juice of it, and it's a fantastic. It's got lycopene in it, and lycopene
Mm,
is a powerhouse of antioxidants and flavonoids. So please consume tomato in some form or the other, tomato juice or tomato soup if possible.
okay.
Okay? Um, I have given a lot of tips today about the food and everything. As I said, that in a 30-minute session or in a 1 hour session, it's very
It's
difficult for
practically,
us
yeah,
to
very
give you
difficult.
a full detailed way of doing things, right?
Yeah.
I tried my best to be able to give you some very helpful tips. I want
Perspectives,
to
yeah.
talk about management also, ना? Because
Wonderful. Yeah.
कभी-कभी ये जो chronic kidney disease का management होता है ना, बहुत daunting हो जाता है. It
Mm,
brings in a lot of anxiety. It brings in a lot of
mm,
stress to family members also,
mm.
along with the patient.
Yeah, yeah,
Um,
true.
so I want to tell you, let's understand some management tips over here.
Mm,
Please keep a check on your blood pressure. Blood pressure is very
mm.
crucial when anybody has any kind of renal function failure.
Yeah, yeah.
So please keep a note on blood pressure. Always keep monitoring it. Um, I mentioned insulin before. Very
Mm,
important. please also, some doctors don't tell people this, but I want to tell you it's very important for you to balance your insulin levels if you have CKD.
Mm,
So buy a glucometer
mm,
and test your sugars regularly. Once in a week, test your fasting sugar, test your post meal sugar, and one
mm,
random sugar in the entire day. Once in a week, keep
yeah.
your records and understand how your blood glucose levels is. That's very, very
Mm,
important.
mm,
Um, please work with a nutritionist, an expert, or a dietitian to be able to guide you on day-to-day things, monitor all your data, help you out in a more personalized manner. Okay.
mm,
Medicines, of course, as prescribed. Taking medicines when you have some kind of an ailment is a blessing. A lot of
mm,
people shy away or get very stressed कि हमको 3 गोली खाना है, 4 गोली खाना है, पर अभी जो करना है वो
mm,
करना है, कर लो, कोई बात नहीं, खाने के
yeah.
साथ साथ हम सब एडजस्ट कर लेंगे. So
Yep.
please take medicines. Don't be scared of medicines. Um, physical activity very important. जितना हो सके, there's no need to do a very big physical activity or anything like that. You might not have the strength to do it, but
Yeah.
basic brisk walk, jogging, a little talk,
Mm,
talking to somebody and just walking in the entire house also sometimes, right? Keep your
mm,
body active. The more active the body is, the better the kidneys will also function. Okay.
mm,
Um, BMI, BMI, which is your basal, metabolic index, your basic weight that is there.
mm,
You need to keep a check on your weight. Please make sure that you don't become overweight or you don't become underweight, right? Um,
mm,
it's very, it's very important for us to, why do we need to have a ideal body weight, right? Because
mm,
if you become higher than your ideal body weight, or if you become lower, it is indicating that there is some or the other problem. Immunity
yeah.
low ho jayega, anemia, there could be nutrition deficiencies like deficiency of vitamin B12, deficiency of
Mm,
D, magnesium, calcium deficiencies, right? But if you maintain a normal weight which is prescribed to you by your dietitian or nutrition expert, you will be aiming for a healthy overall weight and managing your symptoms also correctly. Okay.
yeah.
Sleep is very important. I cannot stress more on this.
Yeah.
CPD patients have to understand that sleep is the only time where your body really recovers. No matter who
Mm,
says what, कि योगा करने से बॉडी rejuvenate हो जाएगा, योगा करने से बॉडी डिटॉक्सिफाई हो जाएगा, उससे होता है, पर nothing like sleep.
mm, yeah.
Recovery only happens when you sleep. You have to be in a deep, deep, deep beta stage or theta stage of your sleep to be able to get that recovery benefit. So please
Mm,
invest time, invest your energy, create a routine, and make good amount of sleep, long hours of sleep, and restful, peaceful sleep a mandatory rule in your life.
mm,
Of course, no smoking and no drinking goes without saying. I mean,
mm,
I'm not somebody who does a lot of no, 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 but I think it's a common sense thing कि अगर आपको कुछ
yeah.
problem होगा तो आप smoking और drinking नहीं करेंगे.
जी.
And last but very, very important, especially in my books, very, very important, mental
Mm,
health, stress, and anxiety. A lot of
mm,
people these days are dealing silently with a lot of anxiety, a lot of stress levels, a lot of depressive, symptoms. If you
mm,
think you have anything like this along with a CKD condition, talk about it, get help, speak
mm,
to a therapist, speak to an anxiety counselor who can help
yeah.
you out with your problems. Because if you're going to be more stressed, ज़्यादा बीपी बढ़ेगा तो ज़्यादा problems होगी. उससे अच्छा,
जी.
please maintain your overall stress levels and try and be more calm. It's going to be very beneficial.
Wonderful. I think that was wonderful. I really appreciate the way that you have tried covering most of the things from the perspective of not only food but overall management. Everything that you said, probably, people, all our listeners, viewers, they have to understand that they have to take every statement very, very seriously, in terms that the knowledge that is shared has a lot of value and it is coming out of experience. Couple of things, बहुत बारी ऐसा होता है कि हमें पता भी होता है, इनमें से कुछ चीजें शायद हमें पता भी होंगी, जैसे स्टॉप स्मोकिंग seems to be something which is known by people. I think
Yes.
the whole difference is between the knowing and implementing it. I think implementation is a tough part,
Yeah.
and but there certainly there are ways where you need to change things basis what's happening with you. So if you are supposed to, then you are supposed to. Well, there are a couple of, we also have, like, I'll probably for next few very short questions, I can take some questions and get little more idea about you. See, one of the bigger challenges, like I said to you, with kidney patient is all about the fluid intake. Okay. And especially when you say about the juices and other stuff, so how frequently do you think, and I understand that you cannot have a one size fit all answer to this,
Yes.
because even for CKD patients, there are patients depending upon their urine output, intake is defined. For
Yeah.
some patients who are stage 1, stage 2, stage 3, stage 4, there are different guidelines
Yeah.
in terms of what fluid consumption should be. But in general, I'm trying to understand is, when they have that kind of a restriction in terms of how much they should be consuming,
Yeah.
should they be because then there are some people who are used to consuming tea also. I'm going to come on tea and coffee and other stuff as well.
Yes.
So but then they are, because and all of this is going to you know take away the portion of what is allowed to you.
Yes.
So is it that they have to really plan on a daily basis, or is it that they should be planning at least certain times in the week? Secondly, should they be consulting? Should they consult either with their dietitian? I understand, of course. So, like experts like you, they can always come talk to you, understand what is right for them, and you're going to look after what exactly is specific to them, and then tell those patients. And there is no generic, but should they be taking also be taking a nephrologist view on this in terms of before starting up something like that?
Yes. Thank you for the question, Mr. Rahul. I'm going to answer
Yeah,
it in two parts. Okay. So
yeah,
the first part is that you mentioned the liquid intake, right?
yeah,
Um,
yeah.
so as per patient's
Hmm,
requirements, right? We'll always suggest the kind of fluid
hmm.
requirements to them for per patient. Now,
Okay.
let's give you an example wherein
Hmm,
you know there is patient A, okay, and
hmm,
patient A, according to the things that we have seen in the patient A's chart, and
hmm,
the diagnosis that has been given, the medication that this patient is taking, considering all
hmm,
these things, right? We have given a basic allowance of 1.5 liter of water in one day to this patient. Okay,
hmm, hmm,
now this 1.5 liter of water. Um, we can be very smart and we can do things
hmm,
in a way where I told you, when we do a juice concentrate, right?
hmm,
I don't know if a lot of people know this, but when we do it, when we take out juice, there is a way
hmm,
in which we can monitor the liquid level that we put inside, wherein we can get more fiber from that fruit or vegetable when we're taking out a juice. Okay.
hmm.
So it's very beneficial that whoever is doing this can take out more fiber in lesser liquid so that the quantity becomes lesser, but they're getting more benefits of that thing that is there inside.
Okay. Okay.
Right? So that's
So
one
does
way
that
of.
also mean, I'm so sorry interrupting, but does that also mean that juice is going to be better than a whole fruit? Like, say, like whatever you say, you take away the fiber and you just consume what probably the extract, you can call it. So is that I mean, should that be a recommended way all the for most of the times?
So let's give you an
For
example
CKD
over
at
here.
least, yeah.
Yeah,
Hmm.
yes, yes, for CKD
Yeah.
only.
Okay. Yeah.
I gave you an example of beetroot before. Okay,
Yeah.
now
Yeah.
let's do
Correct.
this in a way where if you were given, अगर आपको एक दिन में मैंने चार्ट में लिख के दिया है कि आप बीटरूट लेंगे और आप कैरेट
Hmm.
भी लेंगे, right? Now
Hmm.
the smart
Hmm.
way of doing this, if I had to do this for a client on the spot, right?
जी.
आई वुड से आप बीट रूट को बॉईल करके खा लीजिए. ओके, आप उसका
Hmm.
जूस नहीं निकालेंगे. There'll be a certain day
Hmm.
in the day, there'll be a certain timing in the day, and there'll be a certain way of having it and certain quantity of having it, of course,
Hmm.
when you can
Hmm.
cook the beetroot and you can have it. But the carrot you can juice and you can have half a glass of the carrot juice. So this is a way
Hmm.
in which we can smartly work towards understanding
Got it.
what things we want to take in a liquid format and what things we want to actually eat.
Very true. Very true. Right. And the second part that I said was more about like taking the view of nephro. Do you recommend, let's say, if you have a CKD patient? I understand, most of the time nephro, I mean, doctors recommend go to this dietitian and take the diet chart and all that. So, is there a reverse way also sometime done, or it's
Yes.
not required?
So in my experience, okay, how we have done this before is, um,
Mm,
It's really nice when you have, because a lot of CKD patients would also continuously have to go and do like regular checkups and everything. They would have to meet the nephrologist here and there sometime or
Correct.
the other, right?
Correct.
It's very nice if your nutritionist or your dietitian can be in touch with the doctor, or whoever the representative is for the doctor. They can be in
Mm,
touch and they can discuss the case very nicely and very easily. I always
mm,
say that two experts are better than one expert, right? So it's
right.
nice thing we can meet together if we can do things together. So for example, with me, I have great associations with a lot of doctors, right, from
Mm,
different fields. So I always
mm,
do this in a way where if a certain doctor has recommended a client to me, I will
mm.
always keep that doctor in tune with every single thing that we're going to do with the patient, right?
Makes sense. I
Or
think
let's say
that
the
builds.
patient haven't come from a recommendation. If they haven't come from
Yeah,
a
yeah,
recommendation,
yeah, yeah,
we'll
yeah.
tell them that if you would like, you can get your
Right,
nephrologist. We can have a conversation with them and we can keep them in tune with your progress.
right, 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 right. Okay, wonderful. See, there is another thing that I wanted to actually ask you was about, very important thing. People in general, go to YouTube, go over the internet, and do a lot of research. You know, and what happens is, I'll tell you something that we've recently heard in case of kidney patients is that uh, something that is being widely followed by a lot of patients is that to consume raw not only fruits but vegetables, and the recommendation that is coming to them, which is general, again very generic, and what they really learn out of it is that you can eat whatever and whatever amount, uh, whatever you want to eat, but raw. Okay.
Yeah.
And as a result, sometimes you typically what happens is that people probably obviously they start losing weight because they're not otherwise taking carbs or not other stuff that they are supposed to take, and then
Yeah.
the muscles and other parts are lost obviously, and then the impact on creatinine is seen because of loss of muscle and all, and then you probably see a little reduction on that side, and then you probably boast about those results. But that is catching up like anything. It is very difficult for patients to really focus on right things, because somebody who is recommending or suggesting this to you is himself a patient. Okay. And the most important thing, I mean, obviously you're going to trust more to those guys, so this is what I mean, that's a common stuff. You're going to trust somebody that more
Yeah.
of. I understand that this is I don't know what science is being followed in saying so, but this is like very widely and picking up. This is in recent times I'm sharing this with you, that this is what is happening.
Yeah.
Is there a way that people should really follow things that they should what should be done? Because eating right for these guys is extremely important for all patients. It's very
Yes.
important. How can it be stopped? Is there anything that comes to you? Because you being a very professional, you probably, maybe you're coming across a lot of such things where people have borrowed or people have picked up things over the internet and then they've started implementing and that wasn't really working for them.
Yes.
But in case of other people who do not have a probably any issue, any ailment, just have a weight loss as a objective, I think is a different thing. But
Yeah.
somebody who has a who has a issue with health, and it is extremely important for those guys to really look at all these things in a very very proper way.
Yes. It's a real concern. Thank
Yeah.
you, Mr. Babu, for actually bringing it up. And I feel like forums like this and platforms like this are a great
Mm,
way to be able to spread out this information. Um, I get, so every second client or patient who comes in will try to
mm,
give us Google knowledge. He'll be like, oh,
mm,
पर हमने Google पे ये पढ़ा था, हमने Google पे ये पढ़ा था, ऐसा ऐसा करना है, ऐसा ऐसा नहीं कर सकते, ऐसा करना है. So I personally have I have my 2 cents in this, which I will share now,
mm,
right?
mm.
Um, you can read whatever you want on Google. You can do whatever you want, right? It's a free state. We are a democratic country. Nobody cares. Okay, करो जो करना है, ठीक है. But you have to understand that if you're doing generic things, it's fine. It's okay. You won't have repercussions for it. But if you are
Mm,
doing something when you have a condition, you have a health condition, you're taking medications, you have a
mm,
lot of underlying symptoms as well, right?
mm,
So to understand when you are somebody who has these kinds of things, and after
mm.
this, if you're using your own brain or you're using Google ka advice and doing things,
Mm.
uske bhi repercussions होंगे, side effects
Absolutely.
होंगे, सब कुछ होगा.
Yeah.
Now there are experts. in the country, in the
Yeah.
world, right?
Yeah.
For example, somebody like me, right? We spend a
Mm,
lot of our years, a lot of our time, a lot of our effort, right? A lot of personal time, a lot of personal things that we need to do, but we don't do all those things because we have to study, we have to do
yeah. You're
courses,
academically qualified, actually. Yeah.
we have all these qualifications, we're
Yeah.
doing these things day in and day out. And more than
Yeah.
anything else, we have clinical experience also, because I'm
Mm,
dealing, I deal with 10 clients in a day, you know,
mm,
calculate that into
yeah.
the last 5 years. So we have a
Yeah.
lot of clinical background as well, right?
Yeah. True.
We like something that comes from people like us is going to be a sure, short way of doing things. You don't have to do
Mm,
trial and error. अगर
mm,
गूगल
mm,
करेंगे 10 चीज ट्राई करेंगे पता चलेगा कि नहीं काम कर रहा है फिर जाके एक्सपर्ट को मिलेंगे
mm, mm.
यू वेस्ट टाइम एनर्जी मोटिवेशन डीमोटिवेट हो चुके हो अभी अब तक
Correct.
स्टार्टिंग में कर लेते तो
Correct.
इतना ट्रायल एरर नहीं करना पड़ता and you would
Chip.
have got the right information, save the energy, save time also, and just followed a path which finally has led you to getting good results for yourself, ease of
Yeah.
symptoms for yourself also, and you're
True.
in a more peaceful, easy mindset also. ओवर इन्फॉर्मेशन नहीं है, ओवरवेलम नहीं हो चुके हो, क्योंकि हर एक सेकंड पेज पर आपको फिर लेके जाएगा कैंसर के ऊपर गूगल पे
That's very true.
why to do all these things, why to waste so much time and effort? Already दवाइयाँ ले रहे हो, already कुछ ना कुछ
Mm,
प्रॉब्लम है, तो बचा लो
mm,
उतना effort, go to an
mm.
expert, get the right kind of recommendations, get proper
Yeah.
plans, into proper programs and everything, and then you'll get the things that are really meant for you.
True. Wonderful. I think we've got most of and a little very good information. I'm pretty sure people who are all our viewers, all our members of We Together dot care are going to benefit from this. And most important thing that you've been highlighting, and I think which everybody needs to understand, is that you need some or other form of a guidance in managing any of your existing health issues, and
Yes,
that essentially is required to handle things better, with result, keeping the result in mind, result driven rather, I would say it. And for that, you should definitely um, go with the belief that this is things are going to come back. And I think uh, the way you have explained, not only related to food, I think you've tried giving us idea about how things should be managed completely. I understand that this is not practically possible to listen or know everything, half an hour, 45 minutes and an hour's time. uh, but we would certainly like to explore if we can have another sometime a session which could specifically focus on some other part, which is like mental health maybe, and having
yes,
that combo part, which is going to, because this is something which again lots of patients they definitely have challenge dealing with all these things.
sure.
So thank you so much, ma'am. You've been wonderful. You've been the way you've given us the information, and I would certainly request all of the people. Whenever this session happens, we also share details about you. Okay, in terms of how probably if they want to reach out to you, how should they reach out, right? So
Yes.
even if whether it is your social media handles or anything for that matter, right? So we definitely do that, and uh, I would again request all the members to follow such sessions on vtogether.care, where you're going to be. Our objective is to empower you with right information. A lot of times, the information that you may get could sometime be, different that what you want to listen. But we
Yes.
would always come up with something that which is, really that is for you, and which is in your interest, which is in interest of your health, right? So this is what I would really say. So thank you so much, ma'am. Thanks a lot for giving us your time. And you want to say anything before we uh,
No, thank you so
close
much,
it?
Mr. Rahul. It's been a pleasure. I love, so, I'm also an educator along with, all the things that I do. I love
Oh,
educating people because I feel like, it's so important for us to actually give out the
true.
right information,
Very
and
true.
for more people to really understand the logic, the common sense, and the real
Yeah,
essence of things behind every single thing that we do on a day-to-day life, and not just
absolutely.
blindly do something because two people have come and told us this. वो छोटा टिकता
Yeah,
है, लंबा नहीं टिकता है फिर,
Lambani. Very true.
And mental health, you mentioned mental health is my pet project. I am also a
Nice.
counseling psychologist, currently
Okay.
pursuing my master's in clinical psychology, and
Oh, wow.
mental health is something that I'm very passionate about. And we will definitely do a session together whenever the time and the day comes. And
Certainly.
today has been fantastic. Thank you so much for the platform and the opportunity as well.
Thank you so much. We're looking forward for the session on mental health whenever
Yes.
good with you. Yeah. Thank you so much. And I request everybody to, you know, go back on betogether.care for any of the information, a lot of such sessions and interaction with your patients like you, right? And you can feel free to reach out to us for any support, help that you need. Thank you so much. See